42-0 at halftime between La Vista leading Omaha and Burke. Time for the Ortho Nebraska halftime report. And our good friends from Ortho Nebraska are back once again this week. Earlier tonight, Bill Steck has had a chance to catch up with them.
Yeah, guys, we always love talking to Ortho Nebraska. We learn something new every week, and today Dr. Michael Hall is with us, and we're going to talk about concussions. And if a parent thinks that maybe their child has a concussion, what are some of the signs and symptoms?
Yeah, no, that's a great question. I think kind of taking a small step backwards, one of the most important things to do is to understand kind of what a concussion is, and then you'll be able to understand why the symptoms are what they are. The first thing is that, with a concussion, we're not going to see on MRI or on CT scan any injury if we were to do those things. It really comes down to being a function, like a deficiency in the function of the brain. And so a lot of times, if you think about all the different things that the brain does, like it controls our emotions, it helps us balance, it helps us move, it helps us think, it helps us process information. So if you think about all those different things that the brain does, it'll help you realize what are the different symptoms that a concussion can have. So you talk about like sensitivity to light, sensitivity to sound. You might have dizziness, lightheadedness. Parents might notice that their kids are more irritable than they normally would be. They might have difficulty in school with concentrating. So all of those things can be signs of a concussion. And so if you're a parent, if you see that your son out here on the football field or your daughter out in the soccer field maybe took a direct impact to the head, and it doesn't even have to be a direct impact to the head. It could be an impact to the chest where the head gets jostled. And you start noticing some of those symptoms afterwards, reach out to your school's athletic trainer. All of the athletic trainers in the city and the metro area are very well trained. They're well qualified. They know your school's protocol. They'll be able to help guidance from an evaluation standpoint and also a management standpoint. And if that seems to be too much for them, then almost every one of our schools here in the metro area have a physician that is tied to them that they'll be able to reach out to get more guidance from.
And people don't exactly understand this, but there are some things you can do to be preventive.
So there are some things that in the literature they talk about from a prevention standpoint. There's different neuromuscular exercises that you can do to strengthen your neck. They also have new testing out there called sway testing or impact testing. And I will be cautious to say that there is some controversy around some of those different exercises, so I want to be cautious on saying that they're, a foolproof way to take care of things. But I think the most important thing from a preseason standpoint is having that education, making sure that your athletes, especially in football, are taught how to tackle appropriately with appropriate form so that they can prevent as best they can those types of injuries.
All right, that's Dr. Michael Hall, guys, Ortho Nebraska.
Thanks, Dr. Hall and Bill. We're back with more of the Ortho Nebraska halftime show from Burke Stadium after this.